Welcome back to another video. My name is Sean and I am a registered dietitian. Today we are going to be reviewing a low fiber diet. So if you are in the dietetics profession or you're a patient and you've been instructed to follow a low fiber diet for whatever reason, today we are going to talk about what would be on a low fiber diet. Now, if you're an intern or a dietitian working with a patient, make sure that you go to your nutrition care manual and give your patient a handout to take home. That way, when you review it with them, they have something solid for them to actually review if they have any questions. And it might also be helpful to put your number at the top. That way, if they do have any questions for you after they leave, they can always give you a call. So typically with these handouts, I'll explain it something like this. Hi, my name is Sean and I'm your dietitian. You've recently had some GI surgery and this is some information about what we recommend that you follow in terms of diet when you go home. Now, this is just short term for 1 to 2 weeks while you heal up, and we'll go over this handout. This is a low fiber diet. So I'll go over this by food group. Typically with these handouts, they're organized into 2 sections, the recommended and the not recommended food. I don't go over both of them. I go over it by food group, and then I go over the recommended and not recommended per food group. That way I'm not doubling back, if that makes sense. So the first food group on here is whole grains, or grains in general. So keep in mind, your fiber is mainly coming from grains and beans with a little bit of fiber from fruits and vegetables. So there's no fiber in animal products like meat, dairy, and eggs. But in terms of grains, if you want to be strict and go with the handout, patients should only consume white refined grains. So things like white rice, white bread, white tortillas, white pasta, saltine crackers, those little Toll House buttery crackers, Ritz crackers, all made with refined flour. You can also do pretty soft cereals like Cheerios, Rice Krispies, and Corn Flakes because they turn to mush in milk. Now, for me, I personally don't have a problem recommending whole wheat bread, whole wheat tortillas, and whole wheat pasta because even though they're made from a whole grain, they are made from a flour, and they typically break down really well before they hit the large intestine. So I might not recommend that for someone who's had small bowel surgery, but for someone that's had large bowel surgery, I typically don't mind whole grains as long as they're not intact. Now, an intact whole grain would be something like brown rice, quinoa, barley, millet, sorghum, farro. These grains have not been milled into a flour. They're high in fiber and they're going to take a little bit longer to digest. So you're definitely going to want to stay away from those. You also want to stay away from any kind of nuts or seeds that might be on the outside of the bread. Now, typically at this point, your patient will say something like, yeah, I was told not to follow any nuts or seeds because I have diverticular disease. So the nut and seed thing is a myth. It's not. When you have diverticular disease, for example, you have an outpouching in the intestine due to increase in pressure caused from constipation. So constipation increases our risk for things like diverticular disease, internal and external hemorrhoids, as well as hiatal hernias. But it's not food that gets trapped in there like nuts and seeds and corn. It's bacteria. And when that bacteria gets trapped, your immune system attacks it. Now, in worst case scenarios, this diverticuli can perforate and you can end up with a perforated diverticulum, and that's not good. But the nut and seed recommendation is for fiber and not because someone has diverticular disease and just shouldn't eat it at all. The next area on here is protein foods. So your chicken is fine, pulled pork, ground beef, ground turkey, fish. You can do eggs. You can do up to 2 tablespoons of smooth peanut butter per day. Just no chunky peanut butter. We don't want any chunks of meat like pork chops or ribs, any of that tough meat, and nothing with a casing on it. So some sausages or meat have a casing on it, so nothing with a casing on it. You also don't want to have beans. Beans are the highest source of fiber of any food, so we're not doing any beans. So your chicken, your fish, pulled pork, ground beef, ground turkey are all fine. Smooth peanut butter, your eggs. Just no tough meat, no beans, no casing. You could also do tofu. Next on here is dairy. All your dairy products are fine. Your yogurt, your cheese, your milk. There's no fiber in any of those foods. Just don't get any yogurts with little seeds or little skins in them like blueberry. So just double check the label. Vanilla yogurt's fine. Even some of your flavored yogurts, as long as it doesn't have any chunks or bits in it. Next on here is vegetables. For vegetables, there's really only 4 kinds that we recommend. That's mashed potatoes. You can also do baked potatoes, just no skins. Sweet potatoes are also acceptable. So you can do your potatoes, you can do your cooked carrots, your cooked green beans, like the little ones from the can or the mushy ones that we give people here in the hospital, as well as tomato sauce. Now in the tomato sauce, you can't do salsa, so you have to make sure with the tomato sauce that it's smooth. There's no skins, chunks, or seeds in it. So something like spaghetti, perfectly fine. Next on the list is fruit. Again, I write this information down. It's easier to just have a list, of what fruit is okay for them to eat. So I'm okay with bananas, smashed avocados, melon, peeled peaches, peeled pears, the little mandarin oranges, little cuties, and melon like honeydew and cantaloupe. And then for desserts, most of your desserts are fine as long as there's no dried fruit or coconut in them. So something like chocolate cake is okay, not German chocolate cake. You can have vanilla ice cream, but not Rocky Road. If it's around Halloween time, you can have Milky Ways, but not Snickers. So you just don't want any hard bits, nuts and seeds, dried fruit in your desserts, but most of your desserts are fine. This handout also has an example menu at the end of breakfast, lunch, and dinner ideas. So on here, I'll just read them off to you. It's got some white toast, some eggs, some cream of wheat, some margarine, milk is fine, tuna, mayonnaise, white bread, chicken noodle soup. It's got some chicken breast, some white rice, some canned green beans, and some cranberry juice. So those are all low fiber. Typically for 1 to 2 weeks, people need to follow this. Now, you may want to also give them a handout for high fiber and say, after this, you want to slowly increase your fiber intake up to 35 grams if you're a male, 28 if you're women. I personally recommend at least 40 grams of fiber per day. And you want to increase that slowly while maintaining good hydration status, because if you eat more fiber but you don't drink enough fluids, you can actually get more constipated. So long term, people really should follow a high fiber diet, but for the meanwhile, while they recover, 1 to 2 weeks, they should follow a low fiber diet. Ask your patient if they have any questions, thank them for their time, and then you can exit the room and chart on them. So hopefully you found this video helpful. Again, you really should know your low fiber diet educations. You're going to be using them all the time, and it's really you'll really impress your preceptor if you go into your internship already knowing this information. Thanks for watching. If you have any questions, post them down below and subscribe for more content. Cheers.